Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the FLACC pain scale. So what is a FLACC pain scale? Pain is an unpleasant sensory and emotional experience that can range from mild to severe. The FLACC helps healthcare providers evaluate pain intensity in patients who are either too young or unable to express their feelings accurately. FLACC stands for Face, Legs, Activity, Cry and Consolability and is encompassed by a 2-point scale. The face focuses on the nurse or doctor who looks at a patient's facial expression to determine their pain level. The L concerns legs, where the nurse or doctor observes the patient's legs for any signs of discomfort. The A correlates to activity, which includes movement, restlessness, or hyperactivity of the patient. The C relates to cry, where the nurse or doctor assesses the patient's crying and how often they cry in response to pain. Finally, the C represents consolability and assesses how easily the patient is comforted and calmed down. It is a highly versatile tool and can be used by nurses and doctors, caregivers, as well as physiotherapists. Here's how to use the FLACC pain scales. The first step is to read the instructions and complete the exercises listed. You will then need to rate each of the FLACC dimensions on a scale from 0 to 2. Once completed, record and interpret the scores for results. To view a completed example of the FLACC pain scale, simply visit the carepatron.com website. The template can be accessed via our platform once filtered by community, by assessment or notes. Feel free to type in the keyword if you'd like to access the note faster.